I really like it here, for a variety of reasons. I like the culture. What really impresses me about this community, more so than anywhere I've ever been, is how this is such a military, veteran-friendly community. They're so supportive of what we do. It just blows me away. So, that really does mean a lot to me. I'm a 21-year veteran. I spent time in combat and did all the whole 9 yards, 21 years, and retired from the Army. And so this means a lot to me. This is my passion, taking care of soldiers and taking care of their families. This is my thing. But to have this sort of relationship in our community where people are so supportive of this hospital, the media outlets. You guys are great. You're always helping us to get the stories out that really are important, and that means a lot.
When anybody who uses the term the whole 9 yards and supportive the way you do, that's me, and I take an awful lot of abuse for saying that. How is the?
We should have a support group for
we
that,
should,
by the way.
a
We
support
should set a
group.
support
Yes,
group.
I know.
Yeah.
My wife makes fun of me for using the word awkward, okay, or walk. Right?
Yeah.
I'm going to take a walk. It's terrible. What more could the community do to support the VA and support? And I'm going to talk about that in a minute because I dove into your website and I know a bit about my mother's family was all military, so I know quite a bit about the military. But what else could we do to be supportive?
So, one of the things, we do a lot of outreach, and when we outreach, there's a sort of a misunderstanding in terms of if a veteran is eligible to enroll in this hospital, we would encourage them to do so. A lot of veterans are not enrolled here because they have Medicare, or they have Medicare, or they have Medicaid, they have Blue Cross, or some alternative form of insurance. But what's important is that we get reimbursement, and we get funds for every veteran that's enrolled that sees our primary care doctor or mental health provider. And so oftentimes people think, well, that's for somebody else. It's not for somebody else. It's for every eligible veteran that can come and get health care. We want them to do that. We have the capacity. We have all sorts of support that we have available. And so we would ask, if you're a veteran and you're eligible to enroll, come and enroll with us and let us show you what we can do for you, and let us help you, because there's a lot here. And a lot of sort of myths of many years that have gone on and on about who can get care and who can't get care. A lot of people that I've spoken to that have indicated, well, I was in the Korean War and my buddy said I'm not eligible, and they've taken that as the stock answer that's in fact correct, and it's not true. We have a lot of people that we do look at their records and are like, oh no, you are eligible to get health care, so come and check in with us.
Interesting, quick side story. Kayla knows a little bit about this. I have a dumpy little apartment right down the street, and one day there was a young woman in a wheelchair in a uniform jacket, and she was in great distress. And I've been a journalist for a long time and been to some very difficult areas in the world, and I've never seen anybody in this much distress. Was able to figure out that she was a veteran. Said, I'll call the VA, and she said, no, I'm not eligible. One call to your folks here, an ambulance came, pick her up, she was taken in here. Now, because of your privacy rules, unfortunately, I wasn't able to find out what happened to her, but I'm assuming she was in great hands because she was taken here. Why did she not know, aside from the fact that she was in a great deal of distress, why do you think she didn't know that she qualified to come here?
Well, number one, I think sometimes they don't even bother to ask, and that's important, and you have to ask the enrollment eligibility folks. Number two, I think that there's, as I mentioned earlier, a lot of times they talk to somebody and someone gives them bad information, and then they base their sort of decision and their actions upon that, and that's where you've got to get the facts. And so oftentimes I've seen this happen a number of times where people were eligible and they were told, well, you're not eligible because you weren't in the right war era or something, and not true. So
let's clear that up. Who's eligible?
Oh, the eligibility requirements, I could go on and on and on and on. There are a lot of stipulations, so maybe we could provide him with all of that background information.
There's like 8 or 9 priority groups, John, and it goes anywhere from your combat experience to time in theater, depending on war era, to your income level, to injury sustained in training, boot camp, or combat. There's like tons of different subsects. So it's not just subsect, that's a word, yeah.
Yep.
It's not just like one answer, it's like this, and Vicky, who you've met, this is like her whole job.
I'd love to know more.
I'll give you all
Great,
that information.
I'd love to know, that'd be great.
Yeah.
It's
That'd be
it's
great.
very complex, but we do have experts that can actually look at the records of someone and then determine whether they are, in fact, eligible. And then if they are, then our staff, and most often they are.
And you can tell them if they're eligible here. They don't need to go to their buddy or get onto the street.
No,
to
we'll
the-
give them the facts. We'll give it to them straight and say, yes, you are, or no, you're not, or yes, you are, and you have a copay, a sliding scale copay based on your income, and, give them all the sort of the correct information.
I want to talk more about the important issues, the Red Sox, but if I can, you said you've been here since May.
Yeah.
What is the most difficult issue you've faced running a VA facility like this during a pandemic?
Yeah, that's a really good question. Well, and I think to answer that is the what you just said. It's running a hospital, a complex hospital as we are. There's a map right behind you that shows our geographic area of coverage. We cover over 48,000 square miles of space. That's a lot of real estate to cover.
Yes.
We have a clinic all the way up in Craig. We have a clinic in Moab, Utah. We have been providing support to the Navajo and the Ute Nations with COVID, the fourth mission that we've helped. They've had really big problems that we've been helping them with their surveillance of their populations with. So it's running a hospital, and in sort of this complex situation when things are sort of constantly changing. It's the challenges of of late, it's the challenges of getting the COVID-19 vaccination. We use the Moderna, but we've vaccinated over 6,500 people so far, including our staff members. But that in of itself, the logistics of how we vaccinate people, the difficulties in the storage requirements and the mixing requirements with this particular vaccine, it's been a Herculean effort, but I'm very fortunate because I think this is the best team that you could possibly imagine. These folks that work here are steadfast and leaning forward, and it's just it amazes me at what I see and the level of dedication and steadfast support to veterans. This past weekend we had a big event. The Saturday we vaccinated over 300 veterans. I had over 60 staff members that rolled right up and said, okay, I'm helping. We had 25 some odd volunteers. Okay, I'm helping. Everybody wanted to be part of it. Everybody wanted to be involved in supporting this event. And, the veterans came up and they were just beside themselves with very happy, elated. Thanks for doing this. We had some people coming from Moffat County, which is way up in the hinterlands, up in that corner of our catchment area, up there and there, just north of Craig. So so it's been very challenging. To me, this is you were talking about sports analogies, so I'm gonna throw one at you here.
Do it.
But it's a lot like playing in the Super Bowl. We're gonna shift from baseball or World Series. It's a lot like that because this is the game. This is where this is the hard one. It's very hard. It's very complex, and this is where the money is down. This is where it matters. And since I've been here in May, it's just, the staff has blown me away. What they do every day, it really is quite remarkable to see it every day. They make my job easier. I mean, I got to run this place, but it's to see what they do and to see how they do it is really something.
What's the next Super Bowl? What are you facing now in the next week or month? I read today we're 50 million Americans. I mean, President Biden is closing in on his promise to vaccinate 100 million Americans in his first 100 days. How does that affect the VA?
Yeah, so we're right lockstep with the administration's goal to vaccinate as many as we can possibly. You want to get shots in the arm. Our sort of current challenge is this issue of virality, and I was saying about how difficult it is to get the vaccination out to people in highly rural areas.
Yeah.
Again, the distance, the mixing requirements, the time, the travel. So there was emerging, we're waiting to the big thing that we're waiting for is approval of the Johnson & Johnson and Janssen, the J&J vaccination, which has been proven to be 86% effective, but it's only one dose and there's no sort of special storage requirement. So for us, we can really start taking that out using our mobile medical unit, which we have this great big vehicle that travels throughout our region. And that's going to really help us get the vaccination out to people in these very distant areas that travel is very difficult. So that for me is, we've done a really great job here locally in Mesa County and some of the other surrounding counties. But the folks that are really distant from us, that's what really has me, concerned. And I think that this latest JJ&J is really going to help us get that vaccination in the arms of these people that are in highly rural and rural areas.
I'm going to ask you this question in two parts
Yeah.
because it has to do with communication and reviewing all of the voluminous information you have on the VA site. I came across the latest report on that was issued about the Veterans Administration. It was delayed because of COVID, so the last full report you had on health and the VA was from 2018, and the big portion of that was suicide. And suicides have remained steady since about 2011, according to this report. But there is a dip in areas where veterans are getting their information. Same thing with the COVID vaccine. I read where 38%, 40% of veterans are reluctant to get a vaccination shot, except in areas where the communication is really strong. Are you doing everything you need to do to get the word out? And are we doing everything we can do to get the word out and let people know?
Sure. So, I think that this is called vaccine hesitancy. That's what that's sort of the term that's being used now for that. And the way I look at that is that I think if people see, this is probably the most important aspect of this, when our staff and our patients see that our doctors roll up their sleeves and they take the vaccination, it's leadership by example. And that, I think, is really the most significant part of this. People have to see that it's not just what you say, it's what you do, right?
Oh,
That's really what's
absolutely.
important.
Yeah.
So we've had, our staffing right now, vaccination rate is 86%, which is actually I think it's the highest in the VISN. It is highest in the VISN. So a VISN is our sort of geographic controller or parent.
Bunch of people.
Bunch of people,
Right.
right? But in this case, I think what's really important is that our staff have rolled up their sleeve. They've set the example. They've led by example, and people see that. And people, when they see that, they like, okay, if Dr. So-and-so is going to get his vaccination, then it must be safe, and I'm going to line up and I'm going to get mine too. And I think that speaks volumes.
So what can we do then to get the word out to your vets and say, it's time, get vaccinated now?
Yeah, I think that we could, I haven't, so you're rolling that camera, but I think it's like a privacy violation, but whatever. And I'm going to say this, you can edit it out? Okay, no, I'm saying this because I had COVID. And when I had COVID, there's sort of a
Probably
period
got it from a Yankee fan?
yeah, I think I did.
I know
think
you
it was
did.
a Yankee
I know
fan.
you did.
Yeah. So,
Sorry.
So I had COVID, but you have to wait. So in order for me to get the vaccination, I have to wait like 90 days from the period that I last had the symptoms to when I can actually get it. Otherwise, I'll get like really sick.
Yeah, right.
So unfortunately, I haven't. What I wanted Kayla to do is get that thing rolling and show that the director of the hospital is getting his vaccination.
Right.
Again, leadership by example. I haven't been able to do that yet. I will be able to do it soon. And when that happens, I think that we magnify those messages. The
And
chief of
Kayla
staff.
will let us know, and we'll be here.
Yes.
I got mine done yesterday on camera, so
Great.
yes, I agree with you.
You know what I'm saying.
Yes.
It's absolutely like that. Yeah.
So, what else could we do, though? I mean, we enjoy working with Kayla. We enjoy working with you, even though she gets furious with us for stepping on the campus without notifying her.
Well, she's a former Marine, so
Yes.
Semper Fidelis and all that. She's like, that's what she's all about.
Federal campus, John.
Federal campus, right, yes.
Federal
Protect
campus.
the fire, sir.
And that is my number one concern, is keeping Kayla happy. I'll tell you that, Rick. As it is for all of
Kayla's
us.
happy, everybody's happy.
Everybody's
That's
happy.
the way it
There
rolls.
we go. What else can we do? What would you like? Because we do want to do more with you. It's always a pleasure to work with the VA. What can we do?
Yeah, I think that, first of all, I mean, I really, I think this has probably been the most supportive media market I've been in, and I mean that absolutely with 100% sincerity. And I think that if we continue with this relationship where when, there are stories that are interesting that we have to sort of help, get the word out. You guys have been great at that. The PSA sort of things that you've helped with, the messaging that we want to get out, again, important matters. The stories, I think that, I think I'm very proud of the fact that this hospital is rated in our category, our cardiac category level 2, we're rated right now the best in the country. And it's that sort of thing that, we want to amplify those messages. Why? Because it's our VA, our community's VA, and I think there's a lot that people in the community don't know that they should be very proud of.
Yeah, I agree.
I mean, and this
That's
is
why we're here. You're right.
and this is sort of answer your question. It's like, how, to help get those messages out about, it's not, I've been in some markets where it's a very, pejorative. The stories are always sort of pejorative and towards the VA, but this is sort of just the opposite, which is great. And they're balanced stories too. It's not like it's it's sugar coated like you're at the the donut factory. It's just it's the real deal.
The real deal.
Yeah.
I've worked in a lot of other markets too. Love to hear that.
Yeah. Stop and Shop or.
Yeah, Stop and Shop.
Stop and Shop.
Absolutely.
Okay.
Basket probably.
Yeah, there you go. Where'd you shop growing up? Did you ever go to Almax?
I did go to
There we
Almax.
go.
Holy
All right,
God,
we're
you know
good to go.
Almax.
Yes,
Oh, there
Almax.
was one on Baker's Corners.
Right.
Yeah, we
one
used
in
to go to
Cumberland Hill, where there you go.
And then Cumberland Farms.
Yes, named after Cumberland.
That's
Yes,
right, yeah.
absolutely. Oh, Kayla doesn't know what she missed out on. I'll tell you, being in the Marines.
East Coaster, oh yeah.
You guys have never ducked the tough questions. What is the solution to trying to curb this suicide epidemic among veterans?
Yeah, it's a great
It's
question.
it's a terrible disease, if you will. How do you fix it?
So, and I have to go back, I'm a very data-oriented person, and so I have to go back to what the data shows and what the data suggests. And probably one of the biggest pieces of data that we know to be factual is that if a veteran is enrolled with us and they're receiving mental health care, the likelihood of them doing the horrible thing of committing suicide, the likelihood is extremely low.
Mm-hmm.
Whereas on the other side is if they're not, it's an issue.
Right.
So I think the answer with at least making some improvements in this regard is if veterans are having difficulties, let us reach out and help them. And we've got all sorts of wraparound support that we can provide. But get enrolled with us and get connected to our mental health team. And they're wonderful people. They're fantastic people. And that, I think, is largely part of the solution, is getting that support established and getting that support connected to the veteran. And there's times where we also have folks have access to our Veterans Crisis Line 24 hours a day, 7 days a week. I used to work in Canandaigua, New York, and that's where that site was located, or one of the sites that was located. And I went through that place. I met those people. They're all credentialed social workers. They're fantastic people. But the accessing that number, Kayla, if you could maybe pass that along. But that's helpful if you feel like that. The thing about suicide is that it's an impulse. It's an impulse that what studies show is that if you can slow that impulse down, if you can just pause that impulse, that person then after they get out of that impulsive mode, they sort of like, okay, they get through that. There've been things that are being done right now. For example, again going back to the data, the majority of suicides are committed by firearms. The ones that are actually completed suicides, they're by firearms.
Right.
So there's an initiative underway now. It's called Freeze the Keys, in which case, going back to the impulse, it's the individual takes their firearm and they put a lock on it. They take the key and they put it in this plastic thing, and it actually gets frozen, and it gets put in a metal container. It gets put in the freezer, right?
Right.
So if someone has that impulse to commit suicide and they have a firearm, then that moment of impulse will be slowed down, because you can't take that thing out of that thing. It's going to take a while to break that thing apart. What do you got?
The crisis number on your phone.
Oh, okay. Is it on my phone?
I just texted it to you.
Oh, okay. You did?
Look at that. Look at that service.
How about that, huh?
Boy,
She's got this is my wife. Oh, there it is.
Ah!
All right, here's the crisis line number. It's 1-800-273-8255. 8255.
Rick, I bet you Kayla will email that to me if
I
I
bet
ask
she
her
will too.
not.
Or she'll text it to
It's
you.
hard to text
Yeah.
it to me.
So going back to the story, it's trying to understand the things that are actually going to be successful, and if we know that if we can delay that impulse, then chances are good that that person will survive. So we're sort of always looking at ways to do that, and there have been a number of very innovative things that have been sort of suggested and put forward to help that, and that's just one of many. So the VA is committed to this issue, and I think that there's been a lot of innovation that's been put into this. But I think, like, from your perspective, how you guys can help is, again, the message is that if we can get veterans that are not enrolled into our system, and we can get our arms around them with mental health and get them connected to a provider, the numbers show that actually will help prevent suicide, which is a crisis. Every time we lose a veteran because of this, it's just a travesty.
And you're losing young veterans, which is an even greater travesty, I think. In reading that 2018 report, there was also the overriding message of the 2018 report is exactly what you just said. If they get the information that they can get help from the VA, the incidence of suicide drop precipitously. So anything we can do to help get that word out, I
Sure.
commit to doing that on our news broadcast. The other issue was opioids. And I know the VA is making a huge effort to cut back those types of prescriptions and use other pain relief medications or trials. What do you say to that?
So I'm very proud of our local initiative. We've got Dr. Atwater who heads that service up for us, and we have been very successful in getting our veterans who are on high-dose opioids to taper and reduce. And the key to that is to provide alternatives to pain, because pain is at the core of these concerns. When I was on active duty, I started out in an combat infantry division, and I can remember opioids were dispensed. They used to call them Ranger candy, and so it would be like, okay, buck up, you're in pain, here's some Ranger candy, and that's what people called it. And part of that was that,
Really?
yeah, because they wanted people to get back into the fight. They wanted you don't have time to do this. You got to pause. You got to get back in the fight. So here's some stuff, and there you go. So when I look at this right now, where we're at with this is that it's these alternative forms of management of pain, such as chiropractic care, acupuncture care. Battlefield acupuncture has really been very successful.
Really?
And there are also been proven to be other means of effectiveness, different therapies that can be employed. So our center locally, headed up by Dr. Atwater, I can share some data with you that shows. I'm pointing to the line because I remember the chart that we just went over, but it's really been a very steady decline in the actual tapering of opioid use. And you're spot on. Opioids is sort of, when you sort of think about a lot of the suicides are linked to opioid abuse and
Right.
overdoses of opioids as well. That's sort of also a component.
And if you
of
put
this.
opioids and firearms together, according to this study, it is a lethal cocktail, and it happens quickly.
Absolutely, yeah. And then you throw a family event, a divorce, or some sort of family event in the middle of that,
Exactly.
and it's and so, yeah, the importance of opioid reduction and getting people pain management that works for them is really part of what Dr. Atwater has been doing for us, and I'm very proud of that team. And again, I can share some data with you that you'll be like,
Well,
whoa.
that's a separate story, and I will
Yeah.
bug Kayla when she gets
Yeah.
back from her beautiful wedding.
Yeah, she's leaving us. Can you imagine? She's going on a honeymoon. Oh,
Well, you're going
my
to stay
God.
working here, right? Oh, good. All right. Oh, we can't have no, please. When it comes to, again, it sounds like it's communication. Getting the word to vets that you don't need to take opioids. There's other things that you do here at the VA that can help.
Absolutely.
Communication.
Yep.
How do we help with that?
Well, I think that we could maybe I think that a story of that effect, we could sort of do that's a separate story that
Oh,
we
absolutely.
could interview Dr.
Oh,
Atwater.
You always pick up all my stuff enough. Like, I can't thank you enough. I have no idea how you could help me more other than stopping the pandemic from my job being internal communications
Right.
to more external. Like, if we weren't in this, I'd be doling out ideas for stories and press releases like Ranger candy. But my job has significantly shifted internally since March last year. So like, it's not, I would love to talk about other things, but it's hard for me when I'm so focused on protocols and things like that. But every time I send anything out, y'all always pick it up.
Well, we have a philosophy. I mean, I think it's wonderful that we keep talking about how we have to support our troops and support our vets. I do think it's become blather. It's become just, oh yeah, but nobody does anything. I think the time has come in talking to veterans and talking to Kayla. We need to do something. We can say, oh, we support our vets, fly the flag. Aren't they great? Support our troops. Yeah, whoop-de-doo. What can we do, not just say, to help veterans? Not just in the media, but in general, but mostly in the media. What else can we do to try to get people to do something, not just say something?
Yeah, well, I mean, I think that when I look at, again, how this community is involved in this particular, our operations, and I'll give you an example. It was a few months ago now, Pam Schultz, who's our Women's Health Program Coordinator, she with the support, the 100% support of the community, so we have veterans who are pregnant and they're having children, and so with her leadership and with a lot of support from the community, particularly our VSO groups, they all got together and they put together for each of our women veterans a sort of a cornucopia of goodies, right?
Good work.
So they had like a rocking chair for each. They had a big thing of diapers. It was like almost $1,000
$1,000 per
per cornucopia.
Right, but we did a story on that.
That's a nice story.
Yes,
Yeah.
we did a very good story. And
Yeah.
a week later, I'm flying. It was around Christmas. I'm flying back to Texas to be with my family, and I'm talking to a female vet, who said there's no women's program. It's at the VA. And I said, are you kidding me? They help pregnant women. They do this. No, there's nothing at the VA.
Not true.
I know.
And actually, by policy, there has to be now. And this is where I think when you start looking at where we're at right now. So, women veterans are the high. When you look at like growth of the VA, women veterans are the most increasing in terms of cohort numbers. So
Right.
women veterans are where we're growing.
Right.
And that's across the board. The leadership of the VA has recognized that long ago. They've directed that minimum number of resources are brought on board to help address the specific needs of women veterans, because let's face it, it's been a man's service for,
Right.
for many, many, many years.
Sure.
So we have these other things, like for example, when you look at our facility, we have a design to create a separate women's health clinic. Why is that important? Because it is. There are special veteran women needs that we currently don't really have.
Right.
So we need to make sure that our facilities are reflective of all those sort of things that are important to women veterans, which is why we have a very big project right now that's moving forward to provide all those specific needs that we have with women veterans.